High blood pressure is a condition that can be incredibly dangerous if left unmanaged. Hypertension is defined as having a systolic pressure of 140 mm of mercury or higher, or a diastolic pressure of 90 mm of mercury or higher. Symptoms vary from person to person but may include headaches, difficulty breathing, dizziness, and increased heart rate. There are many risk factors associated with high blood pressure, including age, race, diet, and genetics. In order to manage your high blood pressure, it's important to understand the various treatment options available and how you can best prevent the onset of this condition. White coat hypertension. 1. How it differs from normal hypertension. White coat hypertension, also known as white coat syndrome, is a form of hypertension that can be easily misdiagnosed when measured in an office setting. It differs from normal high blood pressure in that it is caused by the body's response to anxiety created from the medical visit environment and usually cannot be replicated in any other environment. White coat hypertension will usually show up as an elevated reading due to the increased levels of adrenaline present shortly before or during medical visits, with normal readings returning outside of these settings. Diagnostic measures must be taken to assess if white coat hypertension exists as opposed to true hypertension and a long-term treatment plan. 2. Coping strategies for stress-induced hypertension. Adopting lifestyle habits and strategies that can help mitigate the effects of the disorder is essential in managing and controlling it. Talk therapy, cognitive behavioral therapy, and supportive psychotherapy can help individuals learn to confront stressors, identify what causes them to act and feel in certain ways, and develop their own coping skills. Exercise helps alleviate physical tension from everyday stress as well as decreases blood pressure levels related to hypertension. In addition, creating an organized schedule for both work and leisure activities to include deep breathing exercises can improve mental health by reducing negative emotions associated with it. Finally, being mindful of dietary choices, including adequate hydration, can play a major role in decreasing stress levels associated with this condition. Lifestyle change. In addition to talking to your doctor about managing your high blood pressure, it's also important to make changes in your lifestyle in order to properly manage the condition. These changes can include sleep and stress management, getting adequate sleep each night, 7 to 9 hours. Decreased sodium intake. Potassium-rich foods to balance sodium's effects. Reducing or eliminating cigarettes and alcohol consumption. Increasing potassium intake through eating fruits and vegetables like bananas, avocados, and spinach, which help balance out the sodium levels in your body. All these diet and lifestyle changes will contribute greatly towards managing your high blood pressure in the long run. Importance of regular checkups. High blood pressure is a serious condition that requires proper management in order to avoid further complications down the road like heart attacks or strokes. By understanding what kind of hypertension you have, white coat or normal, as well as making lifestyle adjustments such as increased sleep habits, decreased sodium intake, increased potassium consumption, and reduced smoking and drinking habits, you can better manage your high blood pressure over time. It's also important not forget regular checkups with your physician or blood pressure monitor, since they will be able to evaluate any changes that have occurred since last visit that might require additional treatments or medications going forward. Taking care of yourself today will ensure better health tomorrow.